Hi everybody, it's Linda. Welcome back to Tips for You. Well, today I want to talk to you about Dupuytren's contracture, and I want to talk to you about my husband's experience with surgery versus the new FDA-approved treatment for it, which is called Xiaflex. And he had those injections. So I wanted to talk to you today about it because his experience is a positive one, and he had a lot of anxiety. And it took him a long time to decide what to do, surgery versus Xiaflex. So I want to share what he went through with you in hopes that it'll give you a little information and you'll know what to expect, and then maybe it'll help you decide what it is you'd like to do. So what is Dupuytren's contracture? If you just turned on to this video because you're a subscriber and you don't know, let me tell you. Well, it is a condition that is incurable. It's a disease really of the connective tissue in your hands. What happens is these knots form in your hands, and then the knots form cords. And it's a very hard fibrous cord. I think it's made out of collagen. And they start to run up the fingers and pull the fingers in so that you end up with fingers like this. And some people, their whole hand gets pulled in. It can really be a tremendous deformity because you can't do anything. You literally cannot straighten your fingers out. You can't put your hands in your pockets. You can't grab things. It generally affects the pinky finger and the ring finger, and it can affect both hands. Usually one hand is worse than the other hand. It primarily affects men, but women can get it as well, and generally people over the age of 50. Although, I'm going to share with you my husband's experience. He was much younger. He was only in his early 20s when he discovered that he had Dupuytren's contracture. It's a hereditary disease that they primarily see in Caucasian people, and a lot of the people that get it are from a Northern European descent. My husband is from Northern European descent, and it does run in families, and my husband's family does have it. His father has it. Although his father never got the cords. His father just has the knots in his hand, and that's it. But my husband got the full-fledged thing. He got the cords. And generally, if you're really young when you get it, like my husband was, it's a very aggressive form of the disease because it's a progressive disease. The disease forms, it kind of takes shape and goes slowly, dragging your fingers in over a period of time. It doesn't happen quickly. And a lot of people, when they're older, they can get it, and they think it's like arthritis or something until they go to a doctor, and the doctor says, oh no, it's not arthritis. So my husband has a brother and a sister, and neither of them have Dupuytren's, but my husband got the Dupuytren's. It can or it cannot happen if it's in your hereditary line. So, how did he find out he had it? Well, he really didn't notice it until it started that he couldn't put his hand in his pocket, like to get change or to get, his keys or whatever. And all of a sudden he noticed, like, gee, I can't get my little pinky finger into my pocket. And that's where he started with it. By the time he really noticed it, his pinky finger was literally like this at a 90-degree angle. And he went to the doctor, and that's how he found out. And back then when he first got it, they really didn't offer any other alternative but surgery to correct it. You had to go to a hand surgeon, and it was a very intricate little surgery because there's a lot of tendons in there and nerves, and they have to untangle these cords around everything. So I think the surgery was like more than 2 hours. But the doctor afterwards was very pleased with it. He was very happy with the outcome. He had done a great job. And he gave my husband a splint, which he wore at night, and he had to massage. He did a little physical therapy for it, and it never returned again. I mean, this was in his right hand, and it's still fine. The pinky finger was a great success. As the years went by, he started developing in his left hand, and it was developing in the ring finger. It got to what happens is it starts to swell and thicken. So the cords were starting to form. He had the lumps at one point, and the cords started thickening right, between like the pad of his finger here and the knuckle, and then up in here. And it got to the point where he couldn't even wear his wedding ring anymore, to take it off. And then it started to, literally get pulled in. So he had the finger again, it was the ring finger, and it was pulled in. But by this time, the Xiaflex had come out. This is the FDA-approved injection. It's a protein and an enzyme that they inject into the cords. It dissolves the cords, and then the doctor will break the cords. And the medication continues to work, dissolving the cords away and freeing up your hand, so your hand is literally straight again. So he was reading everything. He went to the doctor. He didn't know what to do. Does he do the Xiaflex? Does he do the surgery? So he'd had such great success with the surgery on the pinky finger that he decided he's going to go for the surgery. So he had the surgery to correct that ring finger on the left hand. Doctor was very pleased with it. The surgery went very well. He didn't need physical therapy. He didn't need a splint this time for it. And he was on his way. He was very happy with it. There's recovery time and everything else. When you have surgery, there's always more involved. The only thing is, unfortunately, it started to return, but very quickly. Within a year, the cords came back. This time, the cords came back and started coming back towards the middle. So it wasn't just affecting the ring finger anymore, it started affecting the middle finger. And it started sort of causing them to cross. And they were very thick, and they were pulled in, and they were starting to overlap each other. So now he's very uncomfortable with it. He can't put his hand straight. And he's back at the hand doctor talking to him about it, and the doctor said, look, it's up to you what you want to do. You can have the surgery again to correct it, or you can try the Xiaflex. It's important that you find a doctor that has had success using the Xiaflex. He's got to be experienced at it. The doctor we found was very experienced. He had great success with it. He'd done it to many patients with great outcome. So my husband was confident in the doctor. That was out of the way. He liked the doctor. He was confident in his ability. The problem was whether he wanted to take a risk. There's risks with, having this enzyme put in. It can affect and weaken tendons or ligaments, and he didn't know, what to do. He wanted to have the surgery maybe, but he thought, the recovery time, and, it's surgery, and you have to be under anesthetic and everything. So he hemmed and hawed. He went back and forth and read so much, and it took him forever to make up his mind. He finally decided he's going to go this time with the Xiaflex. He's going to try the injection. The doctor said, look, no guarantees. Sometimes it will work, and sometimes it will need another treatment, or it will come back. But he was willing to try it. It's very expensive. So that's the other downfall of it. But you know what? Surgery is expensive too. But the thing with surgery is very often, when you come out of the surgery, it's corrected. But with the Xiaflex, you're just not sure. And are you going to need more, treatments? Is it not going to work for you? And then you're going to need surgery anyway. So these are all things you have to weigh. I'm going to share what we did and what he decided and how his outcome and what he thinks post experience now, looking back. So he opted to have the Xiaflex. He was extremely nervous and apprehensive about it, particularly about the injections into it. So I'm going to tell you, it was nothing like what he thought it was going to be. He was expecting the worst, and it really wasn't bad at all. So day one, he shows up at the doctor's office. The only prep they did was they sprayed his hand with like a very cold spray. It's like a numbing spray, just so he wouldn't feel the injections. He needed 3 injections in the area. And I guess your doctor will determine how many you need, but his were relatively large and thick, affecting 2 fingers. They were overlapping, so that's what it took for him. He said he didn't even feel the first injection. And because the doctor is repeatedly using the same needle, he said sometimes the needle gets a little dull, and that's why by the third time that it's poked into the skin, you might feel it, which is exactly what happened with him. So at the first injection in, he didn't feel it. At the second, if you take a scale from 1 to 10, 10 being like pain, 0 being nothing, he was a 2, he said. He just, he felt it. And then the third injection, he said, was a 3. So this was bearable for him. He was so anxious, he was expecting the worst, and he ended up basically a 2 or a 3, just feeling a little pinching, and that was it. So they bandaged up his hand and told him, not to, use his hand for anything. Don't grip anything. Don't try to use it. Because what happens is that medication that goes in is now going to be dissolving those cords, and you don't want to accidentally break those cords because they're weakened now on your own, because that could hurt. The doctor does it. He knows just how to do it. He does it in his office. He gives you an anesthetic needle in the nerves of the hand so that you won't feel the pain when those cords are broken. So it's important that you follow your doctor's instructions and don't plan on using your hand. That's why they bandage it up, because when something's bandaged, you'll see it. And you'll say, okay, I can't use that hand. And then try to keep it elevated. And then, of course, they tell you to call if you have any weird side effects or anything odd occurs, or you have excruciating pain or anything like that. And he had some bruising, and he had a little bit of pain. I mean, nothing really, just soreness. The only thing I can tell you that he did notice that he had was tender and swollen lymph nodes in the arm that got the injection, in the armpit, like, in that underarm area. So he did feel that, that night. Initially, it was kind of swollen and tender, and obviously that's probably just, something foreign goes into your body, and that's the only side effect he had from it, and it was totally manageable, and it didn't bother him. And then, of course, he had the soreness in the hand. So you have to wait 24 hours before you can see the doctor again, and they say, I think there's a window of 1 to 3 days where you're supposed to go in and have it broken. He wanted to go in as soon as the time was up, because that's less time for him to accidentally do anything to it. And that's why the longer you wait, the more dissolving goes on, the more you're apt to break it, or it breaks on its own yourself. So he went right after the 24-hour period. He went and saw the doctor. Okay, so this is day 2. So it's in the doctor's office. The doctor takes an anesthetic needle and he injects the nerves in the area. Then he takes the hand and he starts manipulating it, and then he breaks the cord. And you hear a big pop. I said to my husband, I wasn't there. I said, did it hurt? And he said, no, it did not hurt at all. And he was so worried about it that, you can work yourself up into something hurting. So I was fully expecting for him to feel it, because he was just so worked up. But he said he didn't feel it at all. I mean, the hand was a little tender from the, Xiaflex, from the injections. But as far as, breaking those cords, not at all. And the doctor looked at it. He was very happy with it. They got the hand completely straight. It was amazing, really. It's like he was amazed. I was amazed. He could put his hand flat again, and it stayed like that. They make you a splint. I think he went on day 3 to get a splint made. He had to go somewhere else to get it, like a physical therapy place that does hand therapy. They made him a splint for his hand, and he wears it at night to go to sleep, just to keep the hand straight. And he wore that, the next night. He makes sure he wears that at night. So then the doctor wants to see you in 30 days to see how it looks and to decide whether or not you might need another treatment. My husband went in 30 days, and unfortunately the doctor thought he should have another treatment. So thankfully this was all covered for insurance for us. We had already met our deductible. He went and had another treatment, same procedure again, and had to get a new splint made after this time, because now the hand was straighter. So it needed a new splint. The degree had changed. and he had great success the second time around. And of course, the second time around, he wasn't anxious about it or nervous. He knew what to expect. Then the doctor was very happy with the treatment. And that was in October, so we're in May. So that was about 8 months ago. And as you can see in this photo, his hand is still very straight. It's wonderful. The cords are gone. It's amazing, he said, that he can even have this with virtually non-existent pain. I mean, he really didn't feel any pain. That's why I really want to hammer that home for you guys, because that was what he was so worried about. And also, very little recovery time. You know, you don't have to go under full anesthesia. This isn't a 2-hour hand surgery. I mean, you know, he had, within 2 days, he was done. The hand was straight, and he was on his way. He just couldn't believe how wonderful it was. He was so happy that he did it. So, looking back, he's still happy he did it. And I'm going to quote him when I tell you what he said. And these are his words. I said to him, if it came back again and your fingers started to contract and you needed to have either surgery or Xiaflex again, and you could have the Xiaflex, which would you opt for? And he said, I would do the Xiaflex in a heartbeat. Those are his words. That's what he would do. He said it's way better than the surgery, very little recovery time, very little downtime. He said the only thing is the expense. It's expensive. But hand surgery is expensive too. But, you know, with the Xiaflex injections, you're never quite sure if it's definitely going to work great for you or not. For him, it worked fantastic. And, you know, you'll have to see your doctor to determine whether you are a candidate for it. Not everyone is. You have to have the cords. And you can't just have the knots, and you know it's there to dissolve the cords. So there's there's things that your hand surgeon will talk to you about that you'll need to know to help you know if you're a candidate for the Xiaflex. But I wanted to share it with you because this was a very positive experience, and it is possible that he could suffer from these again. I mean, so far his right hand is just fine. That one that he operated on, the little pinky finger, is still fine. There are some knots in the right hand. They have not formed cords. He's concerned about it. He's hoping that it doesn't happen. And right now the left hand is great, and he can use both his hands with no problem. I think if you have not used your hands for a very long time because they've been in this kind of position for a very long time, you might need physical therapy to regain strength and movement. This was not his case because his hands were still straightened out, and he went relatively quickly when the ring finger started to bend to have the surgery, and then the Xiaflex he had pretty quickly after that. I think the quicker you go, the better it is, because the longer you wait, the less success you may have in the Xiaflex. You want to kind of get there sooner rather than later, but it was definitely worth it in his opinion. I'm sure there are maybe people who will comment to this video who might not have had a great experience with it. I encourage you all to share your experience. It will help others. Post comments, let the dialogue go on. It'll help people. I'm giving you our experience with it and my husband's experience, and he was very young when he started with it. He's had both sides of it, the surgery and the Xiaflex, and he just, he can't say enough good things about it. But then he had a very good outcome. He had a very good doctor who is very good at what he does. So all I can tell you is do some homework. You've got to do what's best for you, and do find a good doctor and, ask around, ask him how many patients he's done, how much his success rate is, and it'll give you at least the comfort in that area, and then you've got to decide what you want to do. Okay, well, I really hope you found this video helpful. If I see anything changing, where if he has to go back and he does it again or anything, I will share it with you guys in the future to keep you posted on it. For now, he's happy and it's great. He never had any other problem side effects. The injection, the actual substance that they inject into didn't bother him, like I said, except for the armpit with the lymph nodes. And that was really it. So, you know, he wears his splint at night. As a matter of fact, this is what it looks like. It's just a little white splint. I'm hoping if you're new to my channel that you will subscribe, because I have a lot of interesting topics that I cover just to help you in your life, inspire you with tips to lead a better quality life with diet and exercise and beauty and things like that. And if you're one of my subscribers and you just learned about Dupuytren's Contracture, then that's great. I'm glad I could tell you about it. And please visit me at my blogspot where I do a lot of writing. And I'm also on Facebook and Twitter, so we can stay connected there as well. And thanks so much for viewing. I always appreciate your tuning in. Take care now. Bye-bye. Click here to subscribe to my channel. And please click here for more helpful videos on how to lead a better quality life.